Good oral health can increase your lifespan. 3 main pillars you need to pay attention to make your life longer. I'm Dr. Olga Dolghier, board-certified pediatric dentist here at Palm Valley Pediatric Dentistry and Orthodontics. Oral health and your entire health are closely interrelated. There is 3 main pillars you need to pay attention to. Number 1, your TMJ and your bite. Sometimes you wake up in the morning and you say, oh my God, my face hurts, my jaw hurts, I can't even open mouth. Oh, what happened to me? I don't remember doing anything. Well, maybe you did. Maybe when you were sleeping, you were grinding your teeth. Maybe your bite is off. This is all interrelated. And then we're gonna switch to a second pillar, your airway. If you are turning and toasting, you're waking up multiple times during night, your spouse doesn't want to sleep next to you anymore. He's out because you snore. Snoring is not cute. Snoring is indicative of airway obstruction. And there is different type of airway obstruction. Sometimes we associate it with heavy body obesity. Also, it can be a central nervous system airway obstruction, and also can be upper airway obstruction because of tonsils, adenoids, large tongue, and so on. As a dentist, I can see sign of airway obstruction and send you to a specialist, because guess what? If you have airway obstruction, most likely you might have some form of sleep apnea. Sleep apnea directly related to your heart disease. It was multiple cases recorded when person who was snoring suffered from different type of cardiac problems, palpitations, irregular heartbeats, and coronary artery disease. This is all part of your overall health. And third pillar is chronic inflammation. I cannot tell you how many times you look at somebody's mouth and their gums are just bleeding. That's an indication of chronic inflammation. If you look at the mirror, if you notice receding gums, they do not grow back. Most likely, you have periodontal disease. If your teeth with time become looser and looser, and you have that kind of an odd smell from your mouth, that's probably periodontal disease full-blown, because there is different level of periodontal disease. You probably need to see a dentist. What dentists can do in this case, they can determine level of your periodontal disease or gingivitis, prescribe you certain treatment, also maybe have bacterial intervention, checking what kind of bacteria you have. Because believe it or not, new studies shows that bacteria in your mouth and bacteria inside of your arteries, plug in your arteries, can be exactly the same. How did they get there? Most likely it's a chronic inflammation. So chronic inflammation is a big factor of many multiple diseases related to your heart, your overall health, different disorders of your nervous system, and so on. Because if you cannot get a good night's sleep and you suffer with sleep apnea, it affects your teeth, it affects your behavior. In children, it's not uncommon to be diagnosed with ADHD, and after tonsils, adenoids are removed, the ADHD symptoms go away. Also, in little kids who bedwet for a long time after the age of 5 or so, again, can be indication of airway obstruction. Their sleep apnea does not let them sleep good, and they have incompetency during night. So all of those pillars are extremely important. And now we reach the stage of development in dentistry when we are not just technicians who cut teeth and place the filling on. We are actually diagnosing, looking on overall presentation of your health, and telling you that you might have a bigger problem, not just that one adult loose tooth, probably close to some type of heart problems or heart attack. Hope never, but you never know. So pay attention to your oral health. Don't ignore symptoms you know you have. Don't ignore those bloody gums when you brush your teeth, you floss, and a puddle of blood there. That's not good. That's probably a sign of a bigger problem in many cases. And also pay attention to your tongue. You can pull your tongue out, look side to side if you don't see your dentist every 6 months. And if you see white lesions on your tongue, you probably need to go to your dentist because there is cancers. Oral cancer is pretty common. You remember that papillomavirus, which now we have vaccination from, but we didn't before. So adults are more prominent to oral type of cancers with papillomavirus. This is all your overall health. It's not just hole in the tooth. Dental care is important. It's closely related to systemic diseases. I want you to remember that. What do you think about this? If you notice some symptoms, unusual symptoms in your mouth, if your tongue looks bright red, or you have unusual smell from your mouth, or you have loose adult teeth, please let your dentist know. You're welcome to comment below, but it's important to reach the healthcare provider and address that issue. I'm Dr. Olga here, always glad for your comments, and please keep watching my videos. See you next time.